Greetings, everyone. Dr. Garrett here, along with Dr. Harbison, and we are coming at you with another installment of exercise discussion. And for this iteration, we're going to be talking about the lunge. So oftentimes, and even in a lot of the classes that you'll take, we discuss compound movements like a squat or a deadlift or a bench press, and we'll get to those. But we want to spend these first few videos or as we work through this, discussing some of the more underlooked maybe or underutilized movements. We talked about the pull-up already, and we are on the lunge for this episode or this variation. So Dr. Harbison, I'm going to lay it out to you while we discuss the purpose, variations, as well as common faults, and the life cycle or the loading. How do we get someone from who's never done a lunge to loading them up with some external resistance? So Dr. H, take it away with the purpose.
Yeah, thanks. So purpose of the lunge, we look at very fundamentally, I would say we're talking about hip and knee extension. So flexion and extension, but we're working the extensors of the knee being the quadricep group and the extensors at the hip being the gluteus maximus, the hamstrings. So those are the primary muscles that are going to be targeted or loaded with a lunge pattern. Very similar to how you would see in a squat or a deadlift or a lot of those jumping and running type patterns. We see those same muscles being targeted. In the lunge, kind of differently from those two other exercises, the squat and deadlift that I mentioned, we're looking at this more as it's a unilateral exercise for sure. So we're talking one leg as being the primary focus rather than bilateral, and we're incorporating somewhat of a locomotion pattern. You know, the one foot in front of the other, the stepping pattern, where we get there's a little bit more rotation, there's a little bit more involvement of the three planes, let's say, than just a strict squat or a deadlift maybe that we're kind of really stuck in that sagittal plane. So we're getting a little bit more, there's kind of more going on.
Yeah, movement through space.
Yeah. It's a different, more complex, perhaps, movement through space. I think there's a little bit of more connection maybe between the upper and lower halves and kind of tying in some of the trunk, transferring some of the energy there. Similarly to how we see with when we are running or walking, we see some of that contralateral, the arms, we see opposite movement, right, with the shoulders versus the legs. And so there's some of that happening as well with the lunge, obviously depending on how we're loading that. We'll get into that discussion. But for me, that's what I think of when I hear you say, what is the purpose of that? It's a locomotive pattern, a unilateral pattern, and we're loading the hip and knee extensors primarily.
And as a unilateral movement and one that incorporates locomotion and just a greater movement through space than something like a squat or a deadlift, which is, our feet are it's bilateral movement. One of the ways that we see that is in the multitude of variations that are there with the lunge. It was kind of fun thinking about all the variations. Generally, we think of a lunge as stepping straight ahead or straight back, and that's our lunge. But for purposes of this, there are many different ways to execute this movement. So as mentioned, we can step forward, and you can either do this continually. So you take a right step, right, left, right, and move through space that way. You can also just step out with your right foot and perform your reps of the lunge. You can also step back and do that both in place or moving through space backwards. So now we're talking about the sagittal plane, this kind of front to back, but we can also incorporate the frontal plane by doing a lateral lunge. So rather than stepping forward, we can step out to the side and get our hips moving through space that way. And then of course there's stepping variations. So whether we are doing a step up, we can also do a rear elevated Bulgarian split squat or the rear leg is elevated and we're doing that. We can also load it in many different ways. We can either have the weight down by our sides, we can have the weight in a front rack position, an overhead position, or in a back rack position. So just the ways that in the ways we're able to load leads to 4 different variations of that. So this is a diverse movement, even though it's generally simple in nature. We have our lunge demo in the background.
Oh, buddy, Uncle Andy.
That's how we move through space right there.
So as far as we've gone through kind of purpose and kind of some of those different techniques that we can use. So I think the next step is, what are some of the maybe some errors in technique? That would be the next thing I think of is obviously there's a lot of ways we can do this. how do we want to make sure we're not doing it, or what are the things we want to avoid? For me, one of the major ones, I know we'll get into kind of postural stuff. I think that's one of the main things is postural stability, knee stability. Those are major ones that everyone is pretty well aware of. I'll let you discuss those, Dr. G. One of the things for me that I see frequently, one of the common errors is when we talk about kind of the step forward and then step back pattern that you see. And kind of from a lateral perspective, stepping forward and then pushing back. One of the things I would draw the viewer's attention to is when we do that, we have a nice eccentric component, but then when we push back, the loading pretty much stops about here. So we get an incomplete knee and hip extension under load. So the time under tension decreases, and we have an incomplete concentric contraction because we're kind of using momentum to push us back up this way. Whereas if we are doing something like a step back lunge, let's say we're getting a full eccentric contraction here, and then a full hip and knee extension under tension or under load. So we're getting both eccentric and concentric at the same time. So you can do those, like you said, when we talk about variation in technique, walking forward. So if you're stepping left foot, right foot, and bringing yourself up onto that foot, you're getting the same thing where you're getting a full load under eccentric and concentric. The one thing I would say would be a wrong way to do the squat or the lunge is by stepping forward and stepping back, using that kind of momentum to push back into the concentric.
Yeah, and just watching you there gave me an idea for another variation, which is using towels on a sliding surface where we can slide our foot back and we can go multi-directional. Another one I've seen in the past, they call it a drunk step, where you'll step diagonally behind you. So it just got my brain thinking about other variations of lunges. So don't limit yourself just to moving forward and backwards there. As far as the posture and position, this is something that my mentor drilled into my mind. The two words, posture and position, very similar to many other movements. Essentially, think of a back squat and we see a lot of rounding of the shoulders. As far as the spinal position, for me personally, I'm not so concerned with the angle of the spine. Some people are going to be able to stay a little bit more vertical. Some are going to need to arch a little bit more or lean a little bit more forward. But again, ding, 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 like we talked about last week, as long as your spine is generally neutral, that's what we're looking for. We just want to make sure that we're not rounding forward. When you get tired and you start to do a ton of volume, sometimes we just let our chest fall forward and we're almost like that blow up thing at a used car place where it's just, there's no rigidity to the spine. Yeah, exactly. And like when we get tired, and myself included, I just kind of go, oh, I'm just going to fall into this thing rather than making sure that I'm maintaining a nice rigid trunk to keep a neutral spine and neutral posture throughout. So I really should probably be working from the ground up or from the top down, but that's the one I commonly see. And that's kind of right in the center of everything. Yeah. But the lower half that I commonly see is knee position. So the knee will either valgus or varus overly, especially this is something I'm seeing a lot more because of this idea of moving the toes out for a squat. I mean, I don't want to go down a rabbit trail, but basically if you start stepping with your toes out like this and you're lunging and your knees are externally rotated and they're shooting way out, that's the inverse of the valgus where the knee drives in. So we don't want either of those. Ideally for me, I like to keep my knee stacked over my foot. So it shouldn't be, falling significantly on the instep or falling outside. It's generally where the toe is pointed. And for a lunge, I would like to see the toes pointed straight ahead.
Yeah, I would agree. I think if you were to err on one side, I'd rather see the toe pointed slightly in than out. I think one of the dangers that you would get into with, let's say you're stepping forward with the foot slightly out, is getting into that kind of collapsed arch, kind of a navicular drop perhaps, and a valgus stress at the knee. That's kind of a pattern that goes together is allowing the arch to collapse, that then causes the knee to shift in. So you get into this kind of nasty, that type of movement. Whereas the opposite would be slight toe in, maybe kind of an elevated arch, keeps the knee It's hard to keep that arch position and valgus.
Yeah.
If you keep a solid arch, the knee's wanting to stay right over or maybe slightly outside of the ankle, which is a real a solid, powerful position to push off of.
Right. And one of the ways to do that is to drive your big toe into the ground. If you feel like your big toe is coming off, then we're either, overly inverted or inverted. And then I think also sometimes we get we will get onto the ball of our foot and there's too much inversion or eversion where our ankle is getting into this navicular drop. So if we're just gripping, just grip the ground with your toes essentially and be aware of where your feet are. Dr. H is in his socks, and I think that's one of the greatest ways to feel the ground. And go outside and do this on the grass or on concrete or whatever, but use and feel your feet gripping in. I'm not saying we should always do the lunge without our shoes on, but try it without it on, and you'll see how much the feet are working and the toes are working to maintain balance there.
Yeah.
Another common fault that I'll see is either striding too far or not striding far enough. So I don't have one particular way where it's like you need to step exactly 6 inches in front, I don't have a landmark per se. But what I have found to be successful is that our rear leg is generally, like our rear knee, our trailing knee is generally underneath the hip. And then our front leg we take a courageous step out, but we're not taking it so far that we're doing the splits either. So those are some kind of general rules. And again, as far as knee position, we talked about, laterally left or right or in or out, medial or lateral, but also as far as more so front and back, anterior, posterior. Do you want to speak to a specific position you like your knee? For me personally, I know there's a lot of talk of don't let your knee pass your toe. And I'm a little bit mixed here, and it kind of depends. I think depending on the load, whether we're doing a Bulgarian split squat or a lunge or a step up, this is going to change a little bit. So where are you at with this?
Yeah, I would agree. So I think kind of that fits within that conversation of stance width, right? Is if we have a stance that's too narrow,
Mm-hmm.
let's say right here, the tendency is going to have too much dorsiflexion at the ankle and get the knee going this way. Whereas if we err on the side of too wide, you might be concerned with range of motion and having too much hip flexion.
Mm-hmm.
But you've got more room to work with there. So as far as your question about where's the knee, for me, if you're comparing, let's say, a squat, the knee does go out anteriorly a little bit.
Mm-hmm.
I think the same thing should happen with a lunge where we don't want it out here to where the heel's coming off the ground, but I also don't want to be back here,
Mm-hmm.
right? I want to have a little bit of anterior inclination at the tibia, get the knee kind of right over the toe. To me, that's going to maximize both hip and knee extensor musculature, rather than kind of erring too far one way where it'd be more knee dominant, or too far back the other way would be too much hip.
Yeah. So great point. And that got me to think of two things. You said stance width, and we're referring to the front to back, but where do you stand on stance width laterally as well? We don't want to walk a tightrope and be stepping over our foot, but we don't want to be so wide that we're way out here. So for me, again, going back to some of what I've been taught earlier on and versus like having seen this over and over, I like to see the feet starting at about shoulder width apart, or generally like this kind of athletic position, and taking a step straight out from there. Where again, it's an interesting balance, right? Because you don't want to be too narrow, but we definitely don't want to be too wide. So for me, it's about hip to shoulder width, and we're taking a step straight out, making sure that we're not crossing over and taking a step towards the stationary foot. Do you have anything on that?
Yeah, I think I would say keep it simple and step as if you were walking, kind of that natural width. I would say kind of more a hip width would be kind of, I think, a more natural actual width, kind of left to right, or in that frame. I was trying to think as you mentioned that, trying to think of potentially some application for doing an exaggerated lateral step, perhaps with getting the adductors more involved. I'm not sure. I think if you're going to experiment with that, there's probably more application stepping more laterally than there would be kind of crossing. I don't see much benefit to that. But generally speaking, I would say kind of hip width, keep the feet under the hips.
And the reason why perhaps you would go a little bit wider is for sport application. Whereas general population, probably hip width is more than okay. But if you think about sports, the more narrow your stance becomes, the lower your base of support is, or the narrower your base of support. And so we're trying to find that happy medium of being narrow and working within that framework, but not, again, too wide.
Yeah, I could see some application there. You mentioned like kind of with sport of kind of the change of direction where we're kind
Yeah.
of working diagonally almost to kind of
Mhm.
move into that sort of pattern. I
Mhm.
can see that kind of coming into play a little bit.
Yeah, and then that also got me thinking about another variation when you're talking about your heel coming off. There's a strength conditioning coach, Cal Dietz, and he is a big proponent of a heel elevated squat, a heel elevated lunge, and you hear, oh no, the heels are off the ground. But this is, of course, in a controlled environment. It's been progressed through. The foot has developed strength through other exercises, but slightly big. Essentially, if you were to step, let's say this is the plate, and your feet were to go on top of the plate here and your heel's kind of hanging off, you're not raising your heel up, but you're just trying to use the strength of your foot to keep your foot flat rather than sinking down or raising up above, and trying to maintain this kind of normal flat-footed position, but on an elevated surface. And this develops an immense amount of foot strength, which then translates up through the body in this display of power, because this is a important piece of contact in regards to the movement, and then translating to sport and developing power is our foot strength and the coordination of that as well.
Yeah, for sure. Interesting.
So as far as loading, or let's talk about the life cycle. We talked about some the purpose. We talked about the variations, some common faults, and have continued to sprinkle some more stuff in there. What about how do we get someone that can't do a lunge to an overhead walking lunge of 200 pounds? I don't know, whatever. What's the life cycle like for you?
Yeah, I mean, if you're obviously, I would start everybody at body weight and see, are you capable of doing a body weight lunge correctly? Can you control your body through space? That's, before you ever think of throwing external load on somebody, I think that's always step one is let's see you do it with just you and your body.
Mm-hmm.
And kind of work from there. I know you've mentioned that you've worked with some people who couldn't do even a lone body weight lunge. So talk about like some of the ways that you've used for assistance. You kind of mentioned the idea of towel or rope or something like that.
Mm-hmm.
If you have maybe parallel bars would be a great way to kind of have something to hang on to for, let's say, maybe a geriatric population or someone who's just not able-bodied. Something like that, an assisted type of lunge, I would see would be, again, kind of how we talked about previously with the pull-up. Make sure the mechanics are still the same. You're not changing the movement itself, but allowing some assistance to come in there.
Yeah, and I think this is kind of where the coach's eye falls into place. I've taught the lunge to geriatric or older people, to bariatric or obese patients, to special needs, and also to kids. And all four of them, if you were to watch their first rep, you'd say, oh, they can't do it or they don't have strength. But there is a difference. And I noticed this primarily with the kids. Kids are strong enough to do the lunge, but they're not stable yet. They don't have the coordination quite yet. And so the strength is there. It's more so the coordination. So it looks a little like, ooh, like Bambi, trying to walk the first time. And also because it's unilateral and we're stretching out the distance. So it's a little bit more challenging. For kids, it's not usually, or youth, it's not so much the strength per se as it is the coordination. Whereas with the bariatric, the geriatric, and the special needs population, it can be more strength related than coordination related. Although those are like, it's a, what's the word I'm looking for? They work together, they work in tandem, or can at least. So for me, when I worked with both the geriatric or all three of those populations, bariatric, geriatric, and special needs population, I used different methods, but the idea was the same, which is an assisted lunge. And the biggest thing is, to your point, is even if we're using an assisted assistance, whether it's having a rope in front of them so they can keep a good posture and hold on to the rope and pull themselves up with using their legs, or whether we're using boxes on either side, the main thing is I don't want to compromise posture and position for the range of motion. And so if we're using assistance, but when they get up and they're doing one of these things, like, a monster coming out of the ground or something, we don't want that. I'd rather the range of motion be 6 inches shorter, but with a nice neutral spine, rigidity through the trunk, and these other things that we've talked about as far as a proper movement. So using assistance, essentially, shocker, right? We use the band for the pull-ups. We're using some variation of help for working through that. But I just wanted to really focus on not compromising your posture and position for depth here.
Yeah, I think of range of motion as being probably the easiest method of manipulating that for a deconditioned individual, right? It's all right, well, are you lacking knee or hip extensor strength? We can work on that in a smaller range of motion and develop some of that, and then apply it back to the lunge to get you going in that path. I think one of the dangers perhaps with using, let's say, the idea of maybe a box or something on both sides, is if you're doing, let's say you do the lunge pattern, you're supporting yourself equally here, it's really easy to kind of eliminate this pattern where we get kind of that locomotive pattern and just keep everything almost like when you start pressing down with the arms, you get a little bit of a disconnect with the trunk musculature, like they're not forced to engage anymore and be a part of, right, it turns into a tricep extension and everything kind of shuts off here. And so that would be my only thing I would look at. And I think you brought up the idea of maybe holding a rope, or let's say maybe a dowel of some kind, maybe in the right hand as you step forward, and using that to kind of push this way. So you're still getting this pattern that we see locomotively, being able to then kind of stay in the picture with the movement. So agreed. Possibilities with shortening range of motion, working on kind of maybe parsing that into different pieces. Let's do some knee extension within kind of this type of framework where we're just working a small range of motion, kind of a terminal knee extension type of thing, similarly with the hip. So certainly ways that you can assist or adjust technique to meet the needs of the individual. So what's the other end of the spectrum look like as far as when we begin loading for, let's say, more athletic population or someone who's well advanced in training?
Yeah, I mean, generally, I like to see working body weight because of the amount of coordination it takes to move through space, whether we're doing the jump step, the lateral lunge, the stepping up, and all these things. There's plenty of strength and coordination, low-hanging fruit to be developed there, essentially. But once it does come time to load, so I'd like to see people move through some of these twisting and stepping and elevating positions before we load them up. It's not always the case. Because you might have athletes coming in or clients coming in at different stages, and if you're doing groups, and so there's variation here. We'll kind of disclaimer with that, but I like to see, for me personally, I love the front rack lunge. I personally like it more than the back rack, especially if we're walking forward. For whatever reason, when the weight's behind me and I'm taking a step out, I want to keep falling forward. Both of them are going to challenge our trunk. But for me personally, when I take the front rack position, I tend to be much more aware of my posture and feel this kind of these opposing forces having to fight to hold the position. So for me, I like a front rack the best. Overhead is nice. Just be careful that when you're under duress, you're tired, you're fatigued, that our shoulders are a much smaller muscle. And so our legs may be strong enough for it, but our shoulders might not be able to handle it. And as soon as we get unstable at the shoulder and the weight starts to fall forward, or we punch way too far through, it can get dicey pretty quick. So for me, I like the front rack the best as far as loading. What about you?
I've always been a fan of simple, like a handheld load. So whether it's a dumbbell or kind of the strongman implement, the farmer's walk type of thing. I think there's some great application to a variety of things. As with everything, let's look back at what's the goal, what's the purpose, what is our application of this, and then backtracking from there as far as what is going to meet that need the best. Certainly, you can then discuss, all right, well, maybe we have a heavy load in one hand, so we get more of that challenge for rotational and kind of the frontal plane type of activity. Same thing with unilateral overhead or kind of a one-sided rack position. You can do a bunch of different stuff with that to challenge rotation or anti-rotation. Yep. However you want to approach that. Again, go back to the goal. Let's see. I'm trying to think if there are other aspects. One of the things I really enjoy is like a sandbag, kind of an uneven external load, whether it's a sandbag. I've seen you get like a large PVC pipe filled like halfway with water. So you can do some fun stuff to challenge stability and work on it. It's fun. You can have some discussion as far as applicability of all that to not necessarily sport or daily life, but it's
Mm.
fun.
Yeah.
It's a nice way to mix it up and maybe keep things interesting. So those are some of the things I think of for external load.
One last thing. So um, do you see a lunge as a strength building, like a true strength building exercise? So compare it maybe to where do we apply the lunge? Is this in a primary movement in our strength program, or is this more of an accessory movement for you?
I think so. At least speaking personally, and from my own training and training others, it's one that I would be cautious trying to really hit high resist or high external
Like a
resistance.
1 RM, a 3 RM.
Just because it's really hard to maintain correct technique with that. For me personally, one of the things that I'll see is as the external load gets too heavy, I'll start getting the back leg more involved than it should be,
Mhm.
real quick, rather than keeping everything kind of focused on that front foot
Yeah.
and the front leg. So I would use it. There's great application for hypertrophy for sure. You can just torch your knees, knee extensors and hip extensors like no other with the lunge with not much weight.
Mhm.
There's a lot of application there. So I would see it more as an accessory to answer the question directly than a, let's say, a primary movement for a strength day or high intensity type of thing.
Yeah, I'm the same. I like this as an accessory, as a way to build and develop coordination, as a
Yeah.
way to complement something like a squat where we can absolutely overload. And that's in general, right? Generally, we should be massively overloading our bilateral movements. That doesn't mean that we don't go heavy with the unilateral stuff. It's just in general, if I'm looking to build absolute strength, I'm going to generally stick with a bilateral exercise.
Yeah.
However, again, if we're looking for volume, if we're looking for coordination development, the lunge and these unilateral exercises are amazing for that. It's yeah,
Yep. Agreed.
awesome. So I think we got to go around the table a little bit with this, and see, certainly there's value to the lunge, and there's certainly application to it. It's one thing that, again, do not 1 RM your lunge, please. Definitely don't do that. Oh, one other variation: a jump lunge. A jump lunge with rotation into and turning. So I'm realizing more and more that there are a plethora of opportunities for the lunge and variation to that. So have some fun with it, but again, be aware of your posture and position as you are demanding this kind of extra coordination because of it being unilateral.
Good stuff.
All right, see you folks.
Thanks, everybody.